Good afternoon, everyone, and thank you for joining me today for our COVID-19 update here in Erie County. Mark is back with us today, as you can see, and I'm glad to have him back. And out of an abundance of caution, he will interpret via Zoom. Today, we have 178 new cases as of late last evening, which brings us to a cumulative total of 5,798 cases, positive cases, since March here in Erie County. As Director Lyon reported yesterday, the daily case count has overwhelmed the system, and we can no longer accurately report the daily active cases and recovered cases. So the numbers we will be reporting weekly will be estimations of active and recovered cases using the Pennsylvania Department of Health's methodology. What we do know is that roughly 44% of all cases have recovered. So that's 44% of that 5,798 that I mentioned, which means that 56% of those are active cases. And this is as of all the cases since March, 56% are active right now, which I think really brings home the surge that we're seeing right now and how much COVID-19 virus is spreading throughout our community at this particular time. And unfortunately and sadly, we have 4 additional deaths to report in the NED system in the past 24 hours, which brings us to a total of 82 Erie County individuals who have died from COVID-19 this year. And that's 82 too many. That means that the families of 82 people are not going to be able to celebrate the holidays with them this year or ever again. And as of this morning, we have 123 people currently hospitalized within our Erie County hospitals, and 14 of those individuals are on ventilators. So that means since Monday, 2 days ago, we have a count that's 8 people higher in terms of hospitalizations and a count that's 2 people higher on ventilators. And then there's the long haulers, something we haven't talked much about here in Erie County. But these people are, quote unquote, recovered from COVID-19, but have complications still months after they test negative. And I'm not talking about older people here. According to a special that was on just about a week and a half ago on 60 Minutes, younger patients who have had relatively mild symptoms of COVID, cases of COVID, are showing up in doctor's offices and emergency rooms with mysterious and debilitating symptoms months later. If you are interested in learning more about what's being referred to as the long haulers, I recommend that you search that online. I think you'll find many stories on that. I'm sharing this information because there are still some of you out there who believe that this virus is a hoax, or that it's the same or even less harmful than the normal flu virus. And I can assure you, if you ask any healthcare worker who has had to care for an individual suffering from COVID-19, this virus is no hoax. So I ask you to think about the holidays that are upcoming now. Yes, it's December 2nd, and we're still weeks away, but how can you do things differently to celebrate this year? Think about how you can do something unique. I come from a very large family. My parents had 32 grandchildren. So for Thanksgiving, my youngest son, who is in Atlanta, organized a family Zoom call. There was people from Sweden and Anchorage and California and Texas and many places in between. And some of the cousins saw each other for the first time in years. So I think this kind of a Zoom family gathering will become maybe an annual tradition for us for Thanksgiving. But how can you be creative and find ways that you can still be safe and celebrate with your loved ones? Because that's what we all need to do. We need to do things differently during this holiday season as we try to get this COVID-19 virus under control, not only in Erie County, but across this nation. We cannot do this without you. We need your help. We have to collectively come together and do what we know can help mitigate the spread. So what can you do? Well, first of all, of course, always wearing your mask when you go near anyone that does not live with you in your home. Keep that 6 foot distance from others and wear your mask at the same time. And if you're out walking with your friend, I know we used to say, maybe you didn't need to wear your mask. Wear your mask. Always wear that mask when you're out away from home and with others. Stay at home as much as you can. Don't go into large crowded places. If you go into a store, and we're all going to stores this time of year as we get towards the holidays, and the store's crowded, leave and come back at another time. Or find a store that's less crowded that sells the same items. And definitely, if you are feeling ill at all, stay at home. Stay at home. See how you feel the next day. Maybe it's just a little scratch in your throat, but maybe it's COVID-19. And that's what we don't know because so many people have very mild symptoms or no symptoms at all. If you all want to help to take the extra step, I encourage you to go to eriecountypa.gov and take the Safe Choices Pledge in the fight against COVID-19. Acknowledge your role in protecting your family, your coworkers, your neighbors, and our community as a whole. Another thing you can do is to download the COVID Alert PA app. You can put it right on your smartphone, and if you are in the vicinity of someone who does become positive, your phone will get an alert that you have been potentially in contact and could be infected. I'm not going to be sharing all the demographic information today that I always do, but you can find that all still at eriecountypa.gov. Today, I am really pleased to have with us our healthcare systems who are going to help to share an update as we all, I know, are very concerned as we see these numbers rising. Mr. John Gennaro from the VA hospital wasn't able to join us today, but he said that the safe care remains our mission. Erie VAMC remains proactive as they work to mitigate the spread of COVID-19. And he wants to assure all of our veterans that they can continue to rely on the VA healthcare for their care when and where they need it, offering both face-to-face and virtual care to meet their needs. So for any veteran experiencing any symptoms of COVID-19, you can call 868-8661. That's 868-8661. Press 3, and you'll be able to speak to a nurse there. And now I would like to invite our healthcare professionals to join me, and we'll start with Dr. Dan Musio. He's the Chief Medical Officer at Allegheny Health Network St. Vincent's Hospital. Dr. Musio, please join me.
Hello, everyone. We are pressed but doing fine at AHN St. Vincent. We continue to test patients for COVID disease by physician order at one of two locations, the hospital and the Westside Health and Wellness Pavilion in Mill Creek. In addition, we continue to work with the Martin Luther King Center on Chestnut Street to offer additional access to testing on Thursdays. To date, we have tested over 9,500 patients with a definite increase in demand for testing in recent weeks. Our overall rate of positivity has increased to over 9% when it was 6% a month ago. Notably, for the month of November, 29% of the people we tested at our Westside Pavilion have been positive. We have hospitalized over 357 patients to date, which is almost double what it was when St. Vincent reported at the last press conference on November 11th. We currently have 48 patients in the hospital with COVID-19, and 7 of those patients are on ventilators. They are admitted to designated COVID units with negative air pressure rooms and are managed completely separate from our non-COVID patients. By far, our patients hospitalized are older, have chronic conditions like diabetes, obesity, lung disease, and heart disease. About 70% of the hospitalized patients at St. Vincent have been older than 60 years of age, but 22% have been between 41 and 60 years of age. About 2/3 of those patients are discharged to home with or without assistance when their status improves. About 20% are released to nursing homes. St. Vincent has sadly seen 26 patients pass away from COVID in the hospital since the pandemic started. Unfortunately, 11 of those deaths occurred during the month of November. We offer the nationally recognized evidence-based treatment for COVID patients, including convalescent plasma, dexamethasone, and remdesivir. Due to the recent surge in cases, the Allegheny Health Network has decided to limit visitation at its hospitals and outpatient facilities. This change became effective yesterday, Tuesday, December 1st. We are no longer allowing visitors on our inpatient units or in our emergency room. Now, there are some exceptions to this policy, which include labor and delivery, the neonatal intensive care unit, pediatrics, end-of-life care, and patients with cognitive disabilities, communication difficulties, or physical disability. We also allow visitation on the day of discharge so that the patient and their family can get instructions from the doctors and the nursing staff. We will also allow one visitor to accompany patients undergoing surgery or emergency care, but that visitor will be asked to either wait in the waiting room, socially distanced from others, or in their car until our staff contacts them. Finally, some patients undergoing diagnostic testing or ambulatory care may be permitted a support person if special assistance is required. Our staff is using masks and shields exclusively, and our personal protective equipment supplies are good. We are preparing to become a distribution location for the COVID vaccine when it becomes available and the guidelines are released by the government. And as a reminder, please do not forget to get your flu shot as well this season. We are watching the COVID statistics very closely. Our COVID command center team meets daily, including on weekends, to update and modify our plans. I want to take this opportunity to re-emphasize the importance of taking steps to prevent the spread of COVID-19. In sum, wear the darn mask, wash your hands, and don't stand next to people. We really need the community support so that the health systems in this region can keep up with the demand for all kinds of care, not just COVID patients. County Executive Dahlkemper, thank you for the opportunity to speak.
Thank you so much, Dr. Muscio. And now I'd like to welcome back Emily Shears, the Director of Infection Prevention, Quality Improvement, Regulatory and Accreditation Services at UPMC Hammett.
Hi, thank you. On behalf of Hammett, I would like to say thank you for having us back today. As we did expect in the past month, cases of COVID-19 have continued to increase across the nation, including the communities that UPMC serves. And right here in Erie, UPMC Hammett is currently treating the highest number of patients that we've seen to date, 66. I would be remiss if I didn't start by thanking all of our staff for their hard work, endless hours, and sacrifices they make to be here and to provide care for you and our community. Our staff are well trained and highly skilled, and our first priority is their health and safety. Over the past month, we have optimized our operations so that we could quickly scale up to our ability to handle increasing cases of COVID-19. Across our system, COVID-19 patients do currently occupy approximately 1 in 6 hospital beds. We have utilized our plans effectively and continue to ensure that we're able to serve our community. We want to encourage the community to continue to seek care when they require it. Our hospital continues to be one of the safest places you can be, as we're requiring for masking everyone inside the hospital. We have also recently changed our visitation policies, and now we're limiting each patient to 1 support person, and that is to help decrease the risk of spreading undetected virus and in order to protect our staff and patients. We are asking the community to please make wise decisions in regards to your personal choices to help us prevent the spread of this virus and to be able to handle the potential increase in cases that may come. We continue also to encourage the public to practice those public health principles that we know work and have been mentioned already. Please mask, wear it properly so that it covers your mouth and nose. Wear it all the times you are outside of your home and away from your family. Wash your hands frequently, particularly after you touch any common surfaces, and stay home when you're sick. What we have learned also is that COVID-19 has a wide variety of clinical presentations and can be spread by people with even the mildest of symptoms. If you have any concern that you do have COVID-19, please call your doctor and get a video visit to determine the next steps. If you have any medical emergencies, please do not delay. Our UPMC emergency departments are safe and we're ready to care for you. And then as mentioned, please practice physical distancing. If you must gather with others, please make sure you're outdoors, maintaining a safe distance between yourself and others. And to our entire community, when you need care, whether scheduled or emergent, please don't hesitate to come see us at UPMC Hammett. Our outstanding care teams are ready and our facilities are safe. Thank you.
Thank you so much, Emily. And now I'd like to invite Marcus Babiak, the pharmacy director at Mill Creek Community Hospital, to tell us what's going on in their hospital. Thank you.
Thank you very much for the opportunity to join you today. At Mill Creek Community Hospital and Lecom Health, we continue to take a proactive approach to our response to the COVID-19 virus. These include no visitor policy at the hospital, except for those visitors, as Dr. Amuccio said, for either a communication barrier or for an intellectual disability. We do allow visitors for end-of-life care as well, and for other exceptions as outlined by the Pennsylvania Department of Health. We currently have 7 patients admitted to Mill Creek Community Hospital who are positive for the COVID-19 virus, and 2 at Corey Memorial Hospital. At neither location do we have any patients on a ventilator. We do practice a full PPE for all of our patient care due to the surge in the wide community spread and our available PPE at hand. We are practicing full PPE for all of our patient care, not only just in our COVID unit, but across our entire hospital. We as well have registered to be a COVID vaccine provider site, and we are working closely with the State Department of Health for once our allocation becomes available so that we can administer the COVID vaccine to those approved priority populations. And that is the update from Mill Creek Community Hospital and Lecom Health.
Thank you so much, Marcus. I appreciate that. And last, Barb Nichols, the President and Chief Executive Officer at Corey Memorial Hospital, will say a few words about what's going on in Corey.
Okay, thank you, Kathy. As Marcus said, we have 2 patients today in our hospital. We've continued with our no visiting policy that we started in March, with a few exceptions of hospice or mentally or physically challenged people or comfort measures. The staff continues to use the personal protective equipment throughout the entire facility as well as in our clinics. We see patients from the age of 40 to 90. We're seeing an increase in the demand for testing as well as an increase in the positive results. So staff is great, and we continue to be here each day to serve the public, and we're a safe place to come. Thank you.
Thank you, Barb, and thank you all. And I want to just also express gratitude from myself and really from all the residents of Erie County to our healthcare workers who are on the front lines every day and putting themselves at risk for all of our health. And thank you to each and every one of them. Really pleased from deep in my heart, and I think in the hearts of all of us here. So thank you to them. And now we're going to go to the press, and we'll start today with Jet TV.
Hi, County Executive. It's Samir. So I want to backtrack a little to the beginning where you said you really are making this plea to those who believe this is a hoax. It's kind of baffling that we're now 9 months basically into a pandemic, and some people still don't take this to, I guess, the level of sincerity or wherever we would need to be. So why do you think that is? Some people are still kind of put off by this or not actually taking it as serious as they need to.
I think there's less and less people that are not taking it seriously because more people now know someone who's had COVID-19 or currently has COVID-19. So I think those numbers are dwindling. But I do believe there are certain segments of our population. It might be age related, it might be where they reside, it could be a number of different factors, who don't believe the seriousness of this virus, or somehow don't believe that they will be affected or their loved ones will be affected. And so they make choices that are not safe, and they engage in activities, again, that could really help to spread this. So I don't really know why that is, except we know that the leadership of our country for a long time wasn't promoting the mask wearing, and kept saying this was going to be over shortly, and it's not over. In fact, it's as bad as it's ever been in our country. So there's a lot of reasons, I think, that have come together to create sort of this unfortunate situation where too many people don't see the seriousness of it.
And then I want to kind of transition a little bit to this, the long hauler. So is there a medical expert? I don't know if Emily Shears from UPMC Hammett would like to comment on this or anything. Just kind of break it down a little bit further and kind of tell us some of those, I guess, symptoms people are coming in with, and I guess what's exactly going on with them.
I'll open it up to anyone here from, maybe we'll start with Emily to see if she has any information on this.
I actually don't have a lot of information on that, so I don't know if Dr. Musio.
Dr. Musio, do you have any information from your work?
Yes, I mean, the long haulers are typically younger patients. They experience symptoms like fatigue, malaise, body aches, lack of energy. You know, I've heard of patients talking about they're sleeping 16 to 20 hours a day, and they often describe a mental cloudiness, or brain fog is the word that people tend to use. We don't know what's causing it. One of the theories out there is it's some type of autoimmune reaction where your body's actually effectively fought off the virus, but your immune system has not shut down yet, and it's basically overreacting to the virus, and so that's what's causing the symptoms. And that to me makes some sense, because younger patients do have a more robust immune system than older patients, so that might be an explanation why they're more at risk, it seems, to become a long hauler than, say, perhaps an older patient.
Thank you, Dr. Musio. And now we'll go to Erie Times News. David, are you with us?
Hi, Kathy. Yes, I am, Kathy. A question for you. In addition to this overall rise that we've seen in cases for the last almost a month now, we've seen a huge increase in cases at our long-term care facilities. Wanted to ask you your thoughts on that the cases have tripled in the last 3.5 weeks. A majority of the deaths are residents of these long-term care facilities. Just to get your opinion on this, and especially as how this virus affects our most vulnerable residents of this county.
So this is something we were warning about. I was warning about for a long time, that if the numbers got out of hand, like they are currently in Erie County, we would see more cases in not only our nursing homes, but other places where we have congregate living, people all living in the same facility. And the reason for that, of course, is that those people mostly aren't going anywhere, but the people who work with them, the people who care for them, are out in the community. They're amongst their families, maybe with their friends, maybe doing other activities, going shopping, etc., and then they go to work. And we know some of those people actually work in more than one facility. So they might do per diem work at one and then have a full-time job at another, and there's particularly some ancillary workers, maybe those who do, different kinds of therapy, for example, who might definitely go to different facilities. So it just increases the chance that the people who live in these settings will come into contact with somebody who actually is probably asymptomatic, because I don't think those people would go to work if they weren't. They're pretty knowledgeable about the symptoms of COVID-19 and do their best not to spread it. But as we know, there's a lot of asymptomatic people, and that's one of the really tricky and devastating things about this virus. So it's devastating, and I know that there are people out there who kind of brush it off also, and like, oh, well, they're just people in a nursing home, or they're just the oldest amongst us. And yet, every one of those people, those 82 people, somebody loves them. Somebody cares deeply about them and wanted to spend more time with them. And that's the other sadness, is because of this disease, we've had to cut off contact with our loved ones. And I have a father-in-law who's in a nursing home, and of course, I haven't seen him for a very long time, except through a Zoom-type FaceTime method. So these people have value. Every life has value, in my opinion, and we shouldn't brush that off, that many of the people who have passed away are those people who are older and live in nursing homes. And even with comorbidity, some people bring that up a lot, that, well, these people had comorbidity, but many of the things they had, whether it be diabetes or heart disease or whatever, they could have lived for many more years if it wasn't for COVID-19 and been engaged with their family and loved ones. So yes, it's extremely difficult, and I want to thank our hospital systems. I want to thank LECOM, who has been working with each of these facilities through a state contract, and I want to thank, of course, our administration and staff at those homes, because when these people pass away in these nursing homes, they're family to them, and it's very difficult.
And Kathy, just to follow up on that, as far as anything that the county can do or that the county health department can do, is there really any tools in your toolbox to help with the facilities that are battling this surge right now?
So they are under the state's jurisdiction. That's who actually oversees nursing homes, for example. And but we have, I'll say, in other congregate settings that we have more of a connection with. We've actually sent, just as we've done with the school districts, we've sent strike teams in to help those other settings, and they may be a congregate setting, for example, for youth or for some other group. We've sent our strike teams in to our COVID response teams to help them figure out how they can help mitigate the spread within their facilities. So we are trying to assist where we can, but again, LECOM really has been the go-to for the nursing homes in this area, the senior living centers, and you know, they're, I think, doing a great job of trying to help these facilities mitigate. But again, once it gets in there, it's very, very difficult to stop the spread. Erie News Now.
Thank you.
Erie News Now.
Hi, a question for any of the doctors who would like to address it. Realistically, how long are we looking at here? If the current rates of hospitalizations and ventilator usage continues, how long before we'd be overwhelmed?
We'll start with Dr. Musio on that.
Well, obviously our goal is to never be overwhelmed. The modeling that we've been given from our network is to prepare for a doubling or perhaps a tripling of the current hospitalization numbers in the next 6 weeks. So for us, you know, we're at approximately 50 cases, so we're preparing to take care of between 100 and 150 patients in our hospital, and we've developed a surge plan to handle that. So, I mean, for us, you would need to get upwards of 200 cases in our hospital before I think we would be hard pressed. But we've developed a surge plan that really adjusts to each level. You know, so for example, in the spring we had one COVID unit. We subsequently surged to 2 units. 2 weeks ago, we surged to 3 units, and this past weekend, we've surged to a 4th unit. And so we've got this sequential stepwise plan where different units in our hospital become COVID units. And then as we know which each unit is going to be, and then train the nurses, you know, before we make the move to that unit. So I know we have a great deal of capacity left to take care of many more patients.
Thank you. Emily Shears from Hammett.
Along the same premise, we've had our emergency operations, or what we call our capacity plans, in place for months and months. That's something that all hospitals have in place really all the time for this exact purpose. So we are, again, taking it day by day, watching our census. We did peak at 70 patients this past weekend. We're obviously, you know, fluctuating every day. We're at 66 right now. We have 3 different COVID units open, a dedicated ICU. And as Dr. Musio said, we basically have 2 to 3 steps ahead already planned out and ready to be put in place really at the drop of a hat, so that we can continue to meet the demand, the need for healthcare if the demand would arise.
And would either of the other hospitals like to comment?
And I would just like to say the same for Mill Creek Community Hospital. We continue to review our surge plan on a very regular, almost daily basis to make sure that we have the capacity to treat those patients who need our services. We have also outlined further units with which we could convert to dedicated COVID locations if needed, should those services be needed upon.
And Barbara? From Corey? I'm not sure if I don't think we have a video with Barb today. So we'll move on, but I also want to just state that since the beginning, our hospital systems in Erie County and really regionally with some of our neighboring counties have worked very collaboratively together, and I think that's a true testament to those facilities and to our region as a whole. So I want to thank them for doing that because they're looking out in a very global way at how do we help our community get through this. Talk Erie, Joel.
Yes, thank you, County Executive. Maybe to piggyback on Ethan here, not so much on rooms, but let's talk about nurses. Of course, there's the narrative that's out there that there's a nursing shortage maybe before the pandemic. Can you confirm that there was a nursing shortage going into the pandemic? And where does that leave us now as we have this surge? Are there enough acute care nurses and regular med-surg nurses to handle these kind of capacity loads that you guys are experiencing at the hospitals?
Emily, do you want to take that first from Hammett?
Sure. Just as capacity, we monitor our staffing every day. We look at any staffing needs we have to keep those safe patient to staff ratios. That includes nurses, it includes physicians, it also includes ancillary staff as well. So every area of the hospital, that's a metric that we watch very closely. Obviously, when we see an increase in patients, we would love to have an increase in all staff associated with that, but have to keep, again, a tight rein on how many patients we have, what kind of units, what acuity or how severely ill those patients are, and then make decisions in terms of supporting those nurses and physicians to make sure those safe levels are maintained. So staffing is always a concern of ours, especially in a situation like this where we start to prepare. Hospitals, just like nursing homes and other places, are not unaffected by community COVID ourselves. So monitoring also if there are staff that have been quarantined due to community exposures as well.
Thank you. Dr. Musio?
Yeah, I mean, we're focused on staffing as well. Quite frankly, that's a bigger issue than physical space. We look more at staffed beds than we look at beds. Some of the strategies we've invoked to deal with this, we've brought in traveling nurses or nurses from outside the area who we've hired to come in and work for us for the next few months. We're taking nurses from other areas. We've got nurses that work in offices, nurses that might work in the surgery center who are former acute care nurses. They're beginning to come back and work shifts for us. And so those are the two biggest strategies we're using to bulk up our nursing coverage during the pandemic.
Thank you. Would you like to say anything further on that, Marcus, from Mill Creek's perspective?
Sure, and just to kind of continue upon what Dr. Muccio said, I think the biggest risk right now to the staff is the community spread. What a lot of individuals aren't aware of, if you have a positive household contact for COVID-19, you're quarantined not only for the duration of their isolation, but if you're unable to separate yourself from that individual, you're also quarantined for an additional 14 days after the date their isolation ends. So if you're a nurse with a positive spouse, you could be excluded from work up to 24 days after the date of their exposure. And so that is a significant amount of time to lose a staff member for. So the community impact is a significant cause of nursing shortages and overall staff shortages right now.
I think that's an excellent point that you brought up, and I appreciate you bringing that up in terms of the quarantine. A lot of people don't think about that how long they have to stay in quarantine after their family member who lives with them may have gotten out of their isolation. I'm going to see if Barb is there, if she wants to say anything further. Okay, we'll move on then. Thank you. West County Journal, I think we might have Sandy with us today. Is that true?
Yes, I'm here. Thank you, Kathy. I wanted to sort of go back to last week when you had talked about shopping and going online and, not necessarily physically going in the stores. But as you know, Erie's like a mecca for outsiders coming in to shop. How are you going to address that? And is there anything you can do to, keep the shoppers at bay or... it seems frivolous, but yet if you have an onslaught of people coming in, there's going to be more spread.
Yeah, you make a very good point because a lot of people do come to our region, particularly from the counties that are adjacent to us where there's a lot less shopping opportunities and much more here. And we do not have any ability to stop people at the border, for example, of the county and ask them, where they live and what are they coming for. The state has said you should only cross state lines if you are going for work or for medical. Basically, those are some specific reason like that. But there is really no ability to do that. It's really more on people's following those guidelines than it is about the state police or someone else controlling that. And so I go back to the fact that if you go into a store and you feel uncomfortable, you should definitely leave. Or you can have that store drop the item off to you. I was going to talk about Kohl's in a few minutes. A friend of mine had an order at Kohl's, pulled up in front, text in what space he was in. They brought the package right out to the car, very little contact, and got the item that he needed. I've seen that at other stores too. My husband actually had the same experience at Best Buy just the other day. So those are the things we should be thinking about doing, especially if you're a person who has more of a high risk to do those kind of things. But I do feel very, very concerned about our essential workers who work in retail and work in those places who have no choice, obviously, but to go to work every day. And that's why we need people who are going there, for us who are out there shopping, to make sure we're doing what we need to be doing, staying home if we're feeling sick, always wearing our mask over our nose, over our mouth, and of course trying to stay your 6 foot distant from the people who work in those stores if you have a question or when you're checking out. We'll go back to Jet TV and Samir.
Yep. So let's talk a little bit about the nursing home. So Pleasant Ridge, I believe, has 130 plus positive cases, over 50 staff members, and over 20 deaths there. So looking at that, what's the protocol for that? I know that's, I believe, run by the state, but I mean, what are we doing with those nurses out there? I imagine they're probably extremely overwhelmed. Of course, any healthcare facility right now is overwhelmed with everything going on right now. So I guess, is there any measures being taken specifically there?
So I do want to clarify, because I did talk to the CEO out there earlier today, and I want to make sure we have the numbers correct. And as of this morning, they had 105 residents who had tested positive, 17 had passed away, and they have had 55 of those residents cleared, and over the next 5 days, they see 29 who are not clear. Over the next 5 days, they expect those to be cleared. So they seem to be, sort of on the downside, I guess, in terms of the surge that they've seen inside their facility. But I will say, going back to the previous question and your question, that they definitely have nursing issues, and they are working diligently to try to make sure they keep enough staffing in there, and people are working long hours, overtime, extra shifts to take care of the people that they truly care about. And that's the problem, when we all don't do our job on the outside and take care and make sure we don't get COVID and we don't spread COVID to someone else. Eventually it's going to get to somebody who's helping to take care of one of our loved ones. So they do have a significant outbreak there, and they are doing their best to control it. They have worked all along the way with LECOM's rapid response team, and they have actually agreed to allow the state to come in and help them in any other way that they can. But it's not just that nursing home. It's many others here in Erie County and across the Commonwealth, and that's the issue, and across the nation. So that's the issue. Some of the nursing staff and other medical staff that was available when a few spot places in the country were having big surges in the summer or last spring. Now everyone's having those surges across the nation pretty much, and so there just are not a lot of extra staff to go to another area because they're busy where they live.
Thank you for clarifying those numbers. And I do want to talk a little bit with some of the healthcare providers here. Do we know anything about a date for when a COVID vaccine could possibly hit Erie County? I know that's kind of throwing that one out there, but I don't know if they have any insight into a specific date or not.
Maybe we'll start with Marcus Babiak, since he is our pharmacist with us today.
Thank you. At this point, we anticipate here, I think what we're hearing from the Department of Health is sometime in the month of December. We continue to work with them to provide, or to at least receive our allocation for it. Mill Creek Community Hospital has registered, and we have been approved to be an administration site. They're still working, I know, on a national level to distribute those allocations down to the state level. Then once the state level is received, they will further distribute it down to all of the approved administration sites. So we haven't gotten an exact date yet, but I would expect it to be here probably within the next month or so.
Thank you, and I'm assuming that the other facilities would have pretty much the same answer to that, because that's the same answer we are hearing at our health department here in Erie County. Erie Times News?
One in the medical industry will, I guess, be the first to get the vaccination.
I'm sorry, Samir, did you say something?
Oh, yeah, sorry. So I was just following up really quick with the question about the vaccine. So any discussion preliminary right now on who will get that vaccine first? I imagine it's probably going to be healthcare workers.
That's my understanding, that they're putting together a priority list, and of course healthcare workers and nursing homes are going to be two of the priority listed entities that will get those vaccines first.
Thanks.
Sure. Erie Times News, David?
Yes, Kathy, I want to follow up on the vaccine and talk to Emily and Dr. Muccio a little bit about how far along are the plans at each of your hospitals in terms of what staff will get it during the first round of this and how it's going to be distributed. How far along on those plans are you? How exact are those plans right now?
Okay, Dr. Muccio, do you want to go first?
Certainly. We've chosen a site for a distribution. We're going to use our McGarvey Learning Center. That's where we do our flu vaccinations every year, so we've pretty much got that aspect of it worked out. We haven't actually chosen which staff members will receive it first, although I will certainly be lobbying for the nursing staff on the COVID units and then our emergency room, and then followed by the physicians that have the most face-to-face contact with those patients, as well as the other staff members. I think we try to do it in order of who is face-to-face with those patients most often.
Thank you. Emily Shears from Hammett.
The vaccination strategy, obviously every day we're finding out more and more information. As was mentioned, we don't have a date yet, but we do have plans in place at the system level to define which healthcare workers, and so that has not been prescribed yet, but similar to the other healthcare facilities, that will likely be highest risk first in terms of the healthcare worker category.
Thank you. Erie News Now, Ethan?
Hi, a question for Dr. Muccio and Dr. Shears. Looking at, again, the hospital system and capacity, between nurses and beds, all factors that you have to look at here, is there any reason to think that we would have an issue in the month of December? Or do you both feel confident that you'll get through at least this month into the new year before hospitals would really be facing a situation where they had too many patients and not enough beds or not enough nurses?
Dr. Muccio?
Yes, we feel like we have a good plan in place to get us through the month of December and to deal with the potential numbers that the modeling is telling us to expect.
And Emily Shears?
We also have plans in place, but obviously are watching that day by day. We've had the number of inpatients increase week on week, and so we do expect that trend to continue for some time, likely through December.
Thank you.
And doctors, if I could
go ahead, Ethan.
At what point? Doctors, if I can follow up here. At what point would you have to start drastically cutting any sort of, I hate to use the word elective because it makes it sound like they're not important, but non-COVID related, non-immediately life-saving procedures? At what point would you have to start really, really cutting those?
Emily, you want to go first?
Sure. We've mentioned this before. Elective is kind of a misleading term. We would continue to do medically necessary cases. Back in March, we saw some negative outcomes with those cases that were delayed. And so we don't want to reduce the care that would be provided to those patients. However, if there would be a time where we needed to pull staff from other areas of the hospitals, and I think you're alluding to surgical staff, we would do that on a case by case, obviously with the least acuity cases being the ones that would potentially be rescheduled to a later date.
And Dr. Musio?
Yes, that's exactly what we're doing as well. You know, the term elective is a bit of a misnomer. We're looking at, non-urgent but medically necessary surgeries. We're still running a full schedule right now, but we're looking at our schedule every single day, and if the numbers continue to increase, may ultimately need to make some adjustments.
Thank you. Talk Erie. Joel?
Yes, Kathy, this one's for you. I'm getting some criticism coming into the radio show regarding Stephen's strategic communications and this whole health and safety message campaign that the county is doing here. Are you satisfied with the deliverables from Stephen so far, and why couldn't a public relations firm here in Erie fit the bill?
A public relations firm in Erie probably could have, but not a single one of them responded to our request for proposal. So that is why Stevens gave the best proposal of the ones we got. They actually do have an Erie connection, so they're, but not a single firm in Erie put in a proposal.
Are you satisfied with the deliverables? What you're getting so far?
I am, and there'll be a lot more deliverables coming even in the next couple of weeks. So yes.
Thank you.
Mm-hmm. And lastly, Sandy, West County, do you have any, West County Journal, do you have another question?
Just a quick question on the medical side. Many months into this, can we reiterate what symptoms does a patient have to present in order for them to have to be admitted to the hospital?
Dr. Musio?
What can be handled on an outpatient basis?
Dr. Musio, do you want to address that, please?
Yeah, I mean, the number one thing that brings someone into the hospital would be a decrease in their oxygenation, a need for supplemental oxygen. Patients with a normal oxygen saturation, cough, mild shortness of breath, those patients typically are going to be managed at home. But more severe shortness of breath, and particularly when they start to require supplemental oxygen, that's typically when we're admitting patients to the hospital and when they become candidates to start medications like Decadron and Remdesivir, as well as to administer convalescent plasma.
Thank you. Well, thank you all to our representatives from our healthcare facilities here in Erie County. Again, please extend our gratitude to everyone who works there for the yeoman's work that everyone is doing during this very, very difficult time. And now I'd like to talk about a few of our star player businesses. First, Claytopia in the West Erie Plaza is sending the item home that needs to be glazed with the glazing product, and masks are worn at all time, and in-studio painting is by appointment only. Next is Vintage Wonderland on West 8th Street. They have signage and floor markings. Masks are required, and they provided pre-wrapped cookies and popcorn for their shoppers on Small Business Saturday. I've already talked about Kohl's and some of the other places that are doing that curbside pickup. And again, I would ask all of you to find ways, if you can, to support our local businesses when you're doing your holiday shopping and even going and getting that holiday meal that you don't want to cook. Please help our businesses survive this pandemic by supporting them through this very difficult time. And again, everyone, thank you for participating in the mask contest, which ended last night. We saw a lot of festive and expressive masks being worn throughout Erie County, and the winners will be announced after 5 p.m. on December 8th. So as always, I ask all of you to please wear your mask every time you're outside of your home. Stay socially distanced from others you don't live with. Stay away from crowds of people. Stay home when you're not feeling ill. And throughout this pandemic, do your best to stay safe